My name is Eugenia, and I work as a counseling therapist at Davenport Perth Neighborhood and Community Health Center. And I want to just take a minute, because I know we go by this long title of DPNCHC, and it's come up quite a bit this afternoon. So I just wanted to take a second and kind of mention we're a neighborhood center combined with a primary health center. So we have two buildings. We're located just west here on Davenport, sort of just past Symington at 1900 Davenport Road. And we're a neighborhood center that's involved in all sorts of activities for seniors and early years. And we also are a community health center. The work that I do is attached specifically to the primary health. I'm a member of the health team, and I've been working there for the past 10 years, and more specifically involved with delivering DBT for the past 5 years. So that gives a little bit of the context, and there's quite a bit of overlap between some of the things we've been talking about today in terms of family connections and this funding that's been made available for some additional training. So my colleague Debbie Tripp and Debbie works as an addictions mental health counselor therapist. My role is sort of a generalist, so my training's in CBT and trauma work, and we came together about 5 years ago and started doing some training in DBT because we felt like it would be a really great complement for some of the work that we were already doing. So we've been doing this a while, and still this funding that we've been receiving has been instrumental in terms of the kind of work that we're able to offer our clients. So just to give an example of what we're doing is we're participating at CAMH on a bi-weekly basis. This is what this funding is providing. We're working with Carmen Weed, who's one of the leads in DBT training, and we're responsible if those of you who are familiar with DBT know that there's a lot of work in terms of behavioral change, both for the clients that we help and for therapists doing the work. So some of what we've been doing has been, we're responsible for readings, for doing diary logs. It's actually a very interactive training that we're getting. And then we meet there, and we're able to bring some real life situations to Carmen and to the group and kind of work through there. And so even though I've been doing this for 5 years, one of the issues is that the training needs to be ongoing. The support for this kind of work can be really difficult. And I want to just sort of give a little example in terms of when we work in the community, I think that DBT is actually really perfectly designed for treatment at a community-based level. One of the issues is that it's expensive to get training in DBT. So that sort of was an area that became a big gap for a while. For Debbie and I to get that training through CAMH, which we've done over the past several years, it can often exceed several $1,000s just to do that. Give you an example, my professional development allowance per year is $600. So I have a lot of time. I have 70 hours I can do, but I actually don't have a lot of money. So you can imagine that it often comes out of pocket. And this is, I think, a really interesting area that your organization has captured, that there are trained people in the community that can do this work, but just can't always access the proper training that they need. So this has just been really, really huge. And I guess the other thing that I want to mention is that the challenges of working with clients who are identifying self-harming behaviors and suicidality, it can be very challenging. And so being able to continually enhance my knowledge and effectiveness through this hands-on training has been so beneficial for me, but also for the participants in our group. And you know, I'd be happy to give examples of how Carmen Weed has been conducting this training, and I know that they're sort of studying it and we're handing in a lot of material, but you know, just an example of that is there's a DBT modality, modality in validation skills called enthusiastic interrupting. And one of the days that we were reading some of our material and expected to go in, Carmen actually presented as a participant in a group who, when we'd ask about homework completion, would go into what a horrible week I've had. So I don't know if those of you who are involved in family connections can relate to this, but this is not an uncommon dilemma that we're faced with. And with dialectical behavior therapy skills, there's actually a very specific way of addressing that, and we call that enthusiastic interrupting. So on one of these days at our training with Carmen, each participant, there's 10 of us in the group, each participant had to enthusiastically interrupt Carmen as she was trying to tell about her horrible week. And it can be quite challenging to both be validating and to keep on track and actually not escalate certain behaviors. So that's just an anecdotal example of the types of things that we've been offered. So it's been very helpful. I just kind of want to wrap up by saying what some of our next steps are, like what we're hoping to accomplish with some of this extra training. And part of it is we see the need for DBT skills, and we'd like to do more partnering. We're doing some, certainly with Family Connections. We'd like to do more with other organizations. And so this opportunity for this training, we've been working with Canadian Mental Health, CMHA, Canadian Mental Health Association, Mount Sinai, I'm trying to think, there's a few other participants. So we're working with Family Outreach and Response, and we've been really building that partnership. So what we're hoping for in the upcoming years and what we're planning for is to actually increase our capacity. Surfing Tsunamis, that's the name of our group. Ever since we did our first group in September of 2010, our wait list skyrocketed to close to 50 people. And that happened in a very short period of time. Word got out. I should mention all of our services are free. That's important. And so our wait list has been something that we have been struggling with for that time. And one way that we're trying to address that is we're in the process of looking to expand into 2 separate groups where one would address transitional aged youth. So it would be a Surfing Tsunami group that would be with more like 15 to 24-year-olds, and then keep our adult group. So those are some of the ideas that this extra training has actually allowed us to explore and to develop some partnerships for. So that's really what I wanted to say. I'm super excited about hearing Anthony talk about the neural aspects of this. And I guess one of the things we were saying during break was that I think it's a really hopeful time for this kind of work, and it's certainly having this training, having the knowledge of DBT, it's actually it's changed the work that I do as a therapist in terms of feeling like people are saying that they're getting better, they're building a life worth living, their visits to the emergency room are decreasing, their quality of life is improving, and it's tremendously rewarding.